If you wake up every morning and your knees feel stiff, achy, almost rusty, you've probably been told something that sounds logical. It's just aging. Your joints are wearing down. Cartilage disappears over time. But I need you to hear this clearly. Your joints are not car tires. They are not brake pads. They are living tissue. And that single shift in understanding changes everything. I'm Dr. Christina Serrati, and today I want to walk you through what the science actually says about aging joints, because it's very different from the old wear and tear story many of us grew up hearing. Now, before we continue, this is educational information only. Always speak with your own healthcare provider about your specific situation. But what I'm about to share may completely change how you think about your knees. For decades, researchers believed osteoarthritis was mainly mechanical. The idea was simple: use a joint long enough and the cartilage just erodes like rubber. But modern research paints a much more nuanced picture. Yes, mechanical stress plays a role. But biology plays an even bigger one. As we age, certain cells in our bodies enter a state called cellular senescence. These cells stop dividing, but instead of being cleared away efficiently, they linger. Some researchers informally call them zombie cells. These senescent cells release inflammatory signaling molecules known as cytokines. And over time, that low-grade inflammation can influence the tissues around joints, including cartilage, tendons, and synovial lining. This isn't hype. It's an active area of serious scientific investigation, including studies published in respected medical journals. And here's why this matters. If joint pain were purely mechanical damage, there would be very little you could influence. But inflammation? Blood flow? Cellular environment? Those are biological processes. And biological processes can often be modified. Another key factor researchers are examining is microcirculation, specifically the density of tiny blood vessels called capillaries around joint structures. Cartilage itself doesn't have its own direct blood supply. It relies on diffusion from surrounding tissues. If local circulation decreases with age, a phenomenon called capillary rarefaction, nutrient delivery may decline. Less nourishment. Slower repair. More stiffness. But here's the empowering part: circulation is highly responsive to movement, muscle activation, and cardiovascular health. Your joints are not passive victims of time. They are dynamic structures that respond to what you do every single day. And in the next section, I'm going to explain why some common joint fixes may actually be less helpful than you think, and what the research suggests works better, especially after 60. But first, let me ask you something. When your knees hurt, what's the first thing you usually do? Stretch? Walk it off? Take something for pain? Because depending on your answer, you may be unintentionally making things worse. We'll talk about that next. Let's talk about what most people do the moment their knees feel stiff. They stretch. It feels responsible, healthy, proactive. And yes, stretching absolutely has a place in joint care. But here's where many adults over 60 accidentally go wrong. They stretch aggressively. And they stretch too early. First thing in the morning, your joints are at their least lubricated state. Overnight, synovial fluid, the natural lubricant inside your joint capsule, becomes more viscous, thicker, less evenly distributed. So when you wake up and immediately force a deep quad stretch or sink hard into a hamstring stretch, you're asking a cold, stiff joint to tolerate high tension. That can irritate already sensitive tissue. Research in physical therapy and sports medicine journals consistently shows that for aging joints, gentle progressive range of motion work is far safer and often more effective than deep static stretching, especially during flare-ups. The goal is mobilization, not force. If stretching produces sharp pain, that is not breaking through stiffness. That is your body signaling irritation. There's a big difference between mild muscular tension and joint pain. And understanding that difference matters. Now let's talk about walking, because that's the second most common strategy. Moderate walking can absolutely support knee health. In fact, cartilage receives nutrients through a pumping mechanism created by movement. When you walk, you compress and decompress the joint, helping circulate synovial fluid. Think of it like gently squeezing and releasing a sponge. That motion nourishes cartilage. But here's the part many people overlook: surface matters. Volume matters. Timing matters. Long walks on hard concrete create repetitive impact forces that are far different from walking on softer ground like dirt trails, indoor tracks, or even grass. And during an inflammatory flare-up, pushing through high-volume walking can worsen swelling. Scaling back temporarily is not weakness. It's strategy. Work with your body, not against it. Now let's address the elephant in the room: pain medication. Medications like ibuprofen can reduce inflammation short-term. They have a legitimate role when used appropriately. But most physicians agree they are not designed to be permanent daily solutions. Long-term NSAID use may affect the stomach lining, kidneys, and cardiovascular system in some individuals. More importantly, masking pain does not change the biological environment inside the joint. Pain relief without strategy is like muting a fire alarm without checking for smoke. If you find yourself relying on painkillers daily just to move comfortably, that is not a failure, but it is a signal that a broader approach may be necessary. So if aggressive stretching isn't ideal, if walking needs to be strategic, and pain medication is temporary, what actually creates meaningful improvement? In the next section, I'm going to share one of the most promising and research-supported strategies for reducing knee discomfort, especially in adults over 60. And it may surprise you because it doesn't involve movement at all. It involves tension without motion. And it works differently than anything we've discussed so far. Now we're going to talk about something that surprises many of my patients. An exercise that strengthens your knees, improves circulation, and can reduce pain without moving the joint at all. It's called an isometric contraction. And if you're over 60 with knee discomfort, this may be one of the most powerful tools you're not using. An isometric contraction happens when you activate a muscle without changing the angle of the joint. There's effort. There's tension. But there's no visible movement. Think about pushing your palms together firmly. Your chest and arm muscles engage, but your arms don't move. That's isometric. Now here's why this matters for aging joints. First, isometric contractions create internal pressure changes inside the joint capsule. This gentle compression and release helps stimulate circulation of synovial fluid, the natural lubricant that nourishes cartilage. Remember, cartilage has no direct blood supply. It depends on movement-driven diffusion to receive nutrients and remove waste products. Isometrics create that pumping effect without the friction and shear forces that can irritate inflamed tissue. Second, they strengthen the muscles surrounding the knee, particularly the quadriceps and hamstrings, which reduces mechanical stress on the joint itself. When the muscles are stronger, the cartilage carries less load. And that changes how the joint feels during daily activity. Multiple studies published in peer-reviewed sports medicine journals have shown that isometric exercise can reduce pain in individuals with knee osteoarthritis and tendon-related knee pain. Not overnight. Not magically. But measurably. Now let me show you a simple one you can do safely. Sit on the edge of a firm chair. Back straight. Both feet flat on the floor. Choose the knee that bothers you most. Slide that foot slightly forward so your heel stays on the ground but your leg is partially extended. Now, without actually moving your foot, gently press your heel downward into the floor as if you're trying to drag it backward, but don't let it move. You should feel the muscles behind your thigh and around your knee engage. Hold that contraction for 6 to 10 seconds. Then slowly relax. Rest a few seconds. Repeat 5 times. The effort should feel moderate, about 50 to 60% of your maximum strength. This is not a strain. There should be no sharp pain. If there is pain, stop and consult a healthcare professional. Now here's something important. Many people notice that doing this first thing in the morning, even before standing up, reduces that cold start stiffness during their first few steps. Why? Because you're priming circulation, activating stabilizing muscles, waking the joint up gently instead of shocking it with movement. Consistency is where results build. Over days and weeks, the effect compounds. But there's another layer to joint health that most people ignore entirely. And it has nothing to do with exercise. It has to do with what's happening at the cellular level, and what you put on your plate every day. Let's talk about that next. We've talked about movement. Now let's talk about something quieter, but just as powerful. Inflammation. Not the kind where your knee suddenly swells up after twisting it. I'm talking about low-grade, chronic inflammation, the kind you don't necessarily see, but you feel. Stiffness. A dull ache. That persistent heaviness in the joint. As we age, the immune system changes. It becomes slightly more reactive. Researchers sometimes refer to this as inflammaging, a gradual increase in inflammatory signaling that occurs over time. And this matters for your knees because inflammation influences how cartilage cells behave. Remember those senescent, zombie cells we discussed earlier? They don't just sit quietly. They release inflammatory compounds that can affect surrounding tissue. This area of research is still developing, but early findings suggest that reducing systemic inflammation may support joint comfort. Now here's the empowering part. What you eat directly influences inflammation levels in your body. Not overnight. Not dramatically in a single meal. But cumulatively. Over time. There is growing scientific interest in compounds called senolytics, natural molecules that, in laboratory settings, appear to help the body clear senescent cells. Two of the most studied are fisetin and quercetin. Fisetin is found in strawberries, apples, persimmons, and onions. Quercetin is abundant in red onions, capers, dark leafy greens, and berries. Early-stage studies, many still in animal models or small human trials, suggest these compounds may have anti-inflammatory and potentially senolytic properties. But let's be clear. We do not have large-scale clinical trials proving that eating strawberries will reverse joint aging. The science is promising, not conclusive. What we do have strong evidence for is this: dietary patterns rich in whole foods, vegetables, fruits, fatty fish, nuts, olive oil, are consistently associated with lower levels of systemic inflammation. This is essentially the Mediterranean dietary pattern. And it has decades of high-quality research behind it. In contrast, highly processed foods, excess sugar, refined carbohydrates, and industrial seed oils are associated with higher inflammatory markers in many individuals. Again, this is not about perfection. It's about direction. Small shifts. Adding more colorful plants. Choosing olive oil over processed fats. Including fatty fish like salmon or sardines. Staying hydrated, because synovial fluid is largely water. Hydration alone can influence how well joints glide. Now here's something I tell my patients often. Exercise changes the mechanical environment of your joint. Nutrition changes the chemical environment. You need both. In the next section, I'm going to explain what realistic progress actually looks like, because expectations matter just as much as strategy. And if you misunderstand the timeline, you may quit too early. Now I want to talk about something most videos skip. The timeline. Because if you expect instant transformation, you'll feel disappointed. And when people feel disappointed, they quit. Biological adaptation does not happen overnight. But it does happen. When you begin doing gentle isometric contractions consistently, especially in the morning, many people notice something subtle within the first few days. The stiffness feels slightly less intense. Not gone. Just softer. That's likely related to improved synovial fluid circulation and early neuromuscular activation. You're essentially priming the joint before loading it. Within the first 2 to 3 weeks of consistent practice, muscle strength around the knee often improves measurably. And when muscle support improves, joint load decreases. That's when many people report. Walking feels more stable as stairs feel less intimidating and morning discomfort resolves faster. It's not dramatic. It's progressive. Now let's talk about nutrition changes. If you gradually shift toward a more anti-inflammatory dietary pattern, increasing vegetables, berries, olive oil, fatty fish, and reducing processed sugars and refined foods, you may not feel it in a single week. But over several weeks to months, systemic inflammation markers often improve. And that can translate into less background ache, fewer flare-ups, more consistent comfort. The key word here is consistent. Your joints didn't become stiff in 2 weeks. They won't transform in 2 weeks either. But here's what long-term research consistently supports. Exercise-based interventions for knee osteoarthritis significantly improve pain and function over months. Not days. Months. And the improvements accumulate. Now let me say something very important. If you have advanced osteoarthritis, bone-on-bone structural damage, or you've been advised to consider joint replacement, isometric exercises and dietary adjustments are not going to reverse structural collapse. And I will never tell you they will. What they can do is Improve muscular support, reduce symptom severity, enhance mobility, complement medical treatment. This is about stacking advantages, not chasing miracles. And one of the biggest mindset shifts you need to make is this: pain is information, not a life sentence. Your body is adaptive. Even in your 60s, 70s, 80s. Muscle tissue responds to stimulus. Blood vessels respond to movement. Inflammation responds to diet and activity. The idea that joints simply expire at a certain age is outdated thinking. But there's one more critical factor we haven't discussed yet. And it might surprise you. Because it has less to do with knees, and more to do with your cardiovascular system. And if you ignore it, you're missing half the picture. This is the part most people never hear. Your knee health is not just about cartilage. It's about circulation. Specifically, microcirculation. Earlier, we talked about capillary rarefaction, the gradual reduction in the density of tiny blood vessels as we age. Those microscopic vessels are responsible for delivering oxygen and nutrients to the tissues surrounding your joints. And remember, cartilage doesn't have its own direct blood supply. It depends entirely on the health of the surrounding environment. If circulation declines, nutrient delivery declines. Waste removal slows. Repair becomes less efficient. Now here's the powerful connection. The same lifestyle habits that support cardiovascular health also support joint health. When you improve blood flow, you improve the joint environment. Research consistently shows that regular moderate aerobic activity improves endothelial function, that's the health of the lining of your blood vessels. Healthier vessels mean better dilation. Better dilation means better circulation. Better circulation supports tissue resilience. This doesn't mean you need to run marathons. In fact, high-impact activity can be counterproductive if your knees are already irritated. What it does mean is consistent, joint-friendly cardiovascular movement. Examples include brisk walking on softer surfaces, stationary cycling, swimming or water aerobics, elliptical training. These activities elevate heart rate without excessive joint compression. Even 20 to 30 minutes, most days of the week, can significantly improve vascular responsiveness over time. Now here's something even more interesting. Muscle contractions themselves help pump blood back toward the heart. Your calves, for example, act like a secondary pump when you walk. When you're sedentary for long periods, circulation stagnates. And stagnation contributes to stiffness. This is why long periods of sitting often make knees feel worse. Not because sitting damages them, but because inactivity reduces fluid exchange. Movement is nourishment. And the more consistent your movement patterns, the more consistent your joint comfort tends to become. Now let me address a common misconception. If my knees hurt, I should rest completely. Short-term rest during an acute flare-up? Yes. Long-term inactivity? No. Prolonged inactivity leads to muscle weakness, reduced circulation, increased stiffness, greater joint instability. It becomes a cycle. Pain, less movement, weaker muscles, more pain. Breaking that cycle requires strategic movement, not aggressive force, and not complete avoidance. But there's one more layer that determines whether these strategies work long-term. And it's psychological. Because what you believe about your knees directly influences how you use them. Let's talk about that next. I want to talk about something that doesn't show up on an X-ray. But it absolutely shows up in outcomes. Your beliefs about your knees. If you've been told for years that your joints are bone on bone, that they're worn out, that it's only going to get worse, that language shapes behavior. And behavior shapes biology. Now let me be clear, structural changes are real. Osteoarthritis is real. Cartilage thinning is real. But the story we attach to those findings matters. Research in pain science consistently shows that fear of movement, something called kinesiophobia, can amplify pain perception and reduce functional ability. When you believe movement is damaging you, you move less. When you move less, muscles weaken. When muscles weaken, joints carry more load. And when joints carry more load without muscular support, discomfort increases. It becomes a self-reinforcing loop. Pain is not just a structural signal. It's also a neurological experience. Your brain interprets input from joints and tissues. If it perceives threat, it can amplify sensitivity. This doesn't mean pain is in your head. It means pain is influenced by both tissue condition and nervous system response. And here's the empowering part. When you begin moving in controlled, safe, strategic ways, like isometric contractions, you send your nervous system a different message. You demonstrate stability. You demonstrate strength. You demonstrate safety. Over time, that can reduce protective guarding and hypersensitivity. Many people notice that once they regain confidence in their knees, their tolerance for activity improves. They trust the joint again. Confidence is not denial. It's informed engagement. Instead of saying, "My knees are damaged and fragile," shift to, "My knees are aging tissues that respond to how I use them." That shift alone changes how you move. And how you move changes how you feel. Now let's bring everything together. We've discussed cellular inflammation, a microcirculation, isometric strengthening, a anti-inflammatory nutrition, a cardiovascular support, pain psychology. None of these are magic bullets. But together, they form a comprehensive framework. And in the final section, I'm going to give you a simple, realistic action plan you can begin tomorrow morning, without overwhelming yourself. Because progress doesn't require perfection. It requires direction. Now let's make this practical. Because information without action doesn't change anything. If you've stayed with me this far, you understand something powerful. Your knees are not passive victims of age. They are responsive tissues. So here's a simple, realistic 4-week reset plan designed specifically for adults over 60. Not extreme. Not complicated. Sustainable. Week 1, wake the joint up. Your only goal this week is activation. Every morning before standing up, perform 5 rounds of the seated heel isometric contraction we discussed to hold each contraction for 6 to 10 seconds. Keep effort moderate, not maximal. Then, sometime during the day, take a 10 to 15 minute gentle walk on a softer surface. A focus on posture and smooth steps. That's it. You are not trying to fix anything this week. You are simply reintroducing circulation and muscle engagement. Most people notice slightly easier first steps within several days. Subtle progress counts. Week 2, build stability. Now we layer in strength. Continue morning isometrics. Add 2 to 3 additional sets later in the day. Gentle sit to stand repetitions from a chair, 5 to 8 controlled reps. These movements strengthen quadriceps and hip stabilizers, which unload the knee joint. Keep walking moderate. Avoid pushing through sharp pain. Consistency matters more than intensity. Week 3, improve circulation. Now we support vascular health. Add 20 to 25 minutes of low-impact cardiovascular movement 4 to 5 days this week. Options: stationary cycling, a swimming, brisk walking on forgiving terrain. You should be slightly breathless but able to hold a conversation. At the same time, begin shifting nutrition gently. Add 1 extra serving of vegetables daily. Include berries or colorful fruit several times per week. Use olive oil instead of processed fats. Increase water intake. No crash diets. No extremes. Direction, not perfection. Week 4, reinforce confidence. This is where the psychological shift happens. Notice what feels easier. Stairs? Standing from a chair? Getting out of bed? Your nervous system is learning that movement is safe again. Continue everything from prior weeks. If tolerated, gradually extend walks by 5 minutes. And most importantly, stop narrating your knees as failing. Start describing them as adapting. That mental shift reduces protective tension patterns that contribute to stiffness. Now let me close with honesty. If you have advanced structural damage, this plan is supportive, not curative. Always work with your physician or physical therapist if you have significant limitations. But for many adults, these layered changes improve strength, improve circulation, a lower inflammatory burden, reduce stiffness, restore confidence over months. That adds up. Getting older does change tissue biology. But decline is not automatic. Adaptation remains possible at every age. Start tomorrow morning. 5 contractions. 10 minutes of walking. 1 better food choice. Small actions. Compounded daily. Create meaningful change. I'm Dr. Christina Serrati. And your joints are far more capable than you've been told.